Hi there, my name is Carolyn Whiting. I'm the Manager of Analytics and Planning for Niagara Region. I'm happy to be here to speak with you today about COVax. I'm going to do a little bit of a quick intro to COVax and then hand it over to my colleague Nathan, and he'll be able to provide some detailed information. So COVax is the provincial database that was rolled out by the province back in December of 2020. It is the sole documentation system for documenting all COVID vaccines in Ontario. It is also where COVID vaccine inventory is managed. So for some offices who are already used to using electronic documentation for administration of vaccines, this should be an easy transition. For some, it'll be a larger learning curve. For this system, each person using it will be required to have user access, that is their own user access, to the COVax system, which will be set up by our BSAs here at the region. So that would be Nathan. It is really important that you designate individuals for specific roles, and based on those roles, you will be able to conduct different tasks within the COVax system. Nathan will speak more about user roles and which user roles access what within the system, as well as how to submit your names for access. You will notice in your training for COVax that there is a client flow, check-in, administration, and checkout. This is all within the COVax system. This will also fit nicely in your clinic as you have clients come in, they're checked in, they will be immunized as administration, and then they will be checked out. It is a fairly user-friendly system, and your training will be done via teleconference with WebMD. It's important that if you have any questions at that time, that you ask those questions on that teleconference. One thing I also wanted to mention is that WebMD has job aids to support practice. These are basically cheat sheets. They just need to be requested. So there is an email on the WebMD link. I would encourage all physician offices to reach out and obtain those job aids. It is important to note, though, that they do update frequently. So check back with the province on a frequent basis, as COVax does change quite frequently. Additionally, during training, I want everybody to really pay particular attention to inventory management. As I mentioned, inventory is managed within the COVax system. It's really important that inventory, and all data in COVax for that matter, is entered in an accurate way and is correct. Nathan will be reviewing specific inventory requirements shortly, but the reason it's so important is because we take this data and we use it for reporting to the public, the ministry, and the medical officer of health. We have had some scenarios where primary care offices or pharmacies have changed some inventory in COVax or entered things incorrectly, and this has really affected our reports. So accurate data entry and following the guidelines for inventory management is extremely pivotal when it comes to COVax. So with that, I'm going to hand it over to Nathan to get into the particulars of COVax.
Thanks, Carolyn. Hi, everyone. My name is Nathan Smith. I'm the business support analyst for the Niagara Region Public Health. Specifically, I'll be handling a lot of the COVax-related information, COVax-related setups regarding your primary care sites. So I'm going to briefly go through essentially what we're providing you to set your office up within COVax, as well as the individual things that we are going to require from you on a daily basis. And then we'll finish with some contact information, frequently asked questions, those types of things. Moving forward here, through the provincial COVax system, this is the system where all of our COVID-19 vaccination doses are actually recorded. So this is province-wide. You'll notice as you onboard, a lot of your clients that are coming in for second doses, well, all of your clients that are coming in for second doses will already be existing within this system. So you, again, your job will be to data validate, to be checking in, and to go through the process of actually administering your product within this particular system. It is a provincial ministry application, so it's not developed by Niagara Region Public Health. However, myself and my colleagues, we do act as essentially a bridge. So if you do have any questions, comments, concerns, or you need any additional explanations, we are more than happy to assist in working through this particular system with you. So first things first, the training that you are going to receive in an email, this is the Ontario MD training. So within this, the link on this site here, again, this will be emailed to you as well, but this page does go over individual training specific to COVax, tailored for primary care practices. The two primary trainings listed on this site are the end-to-end training. So that's a detailed explanation of COVax features, specifically for somebody who is very interested in getting into the nitty-gritty, learning about the individual features from a higher level. It's definitely a far more detailed explanation. And then there's the COVaxON clinical workflow training, which is the general daily workflow. That would be the training that you would provide individuals who, again, are more of a either going to be vaccinating or going to be checking in, checking out. That is certainly sufficient to provide a user the knowledge to continue throughout their day and process a client all the way through the COVax system. There are live trainings available on this site. So when you do click in, you'll see the times available. They host Q&As, live trainings. If at all possible, I do recommend going to one of those trainings. They are extremely informative, again, so that if you do have any questions, you can kind of ask somebody live as they do go through it. However, if you're not able to make any of these trainings, there is the option to view previous recordings of these trainings as well, which again are quite helpful. You'll get to hear the other questions that other practices had asked, and that very likely should be sufficient for you as well. Moving forward here, we have the user accounts and review of the roles. So the two roles that you're going to be assigned are either going to be a COVax site staff or a COVax primary care vaccinator. The primary care vaccinator role is a recent addition to COVax. So they've now actually put these roles in their own group. They are different from the roles within our mass immunization sites. The COVax site staff, that's going to be any individual such as a receptionist or anybody who's not going to actually be administering within COVax would be a site staff. So they would have the ability to, when a client walks through the door, they could check them in COVax, they could check them out, they can search for clients, and they can make modifications to clients' data. So they can modify the vaccination events, they can modify personal information such as health card number, address, phone number, email address, that type of thing. The other role is the COVax vaccinator or a primary care vaccinator role. So that does contain all the permissions of a standard site staff user. So in the event that the vaccinator does need to check in or check out an individual, they can certainly do all of that. They can look up individuals the same as the site staff. They just have the additional abilities to vaccinate within COVax. So the general process is that a client will be checked in, they'll be seated, they'll go through the various eligibility surveys. So the questions that a vaccinator will ask to determine that the client is eligible to vaccinate. And then the dose administration. So the vaccinator themselves will have to administer the dose, and it's tied to them as a provider within COVax. So that'll be the dose that will stay on the client's profile, specifying who gave it to them, the time that they actually received it, the location they received it, and the specific product that they received. So the difference there is that obviously a normal site staff cannot do the administration aspect of this process. The other extra additional permission that the vaccinator has that the site staff does not have is the ability to record inventory transactions at the vaccination event inventory level. So that's your extra doses and your wasted doses. That's something that we're going to touch on a little bit later, and we'll touch on it in quite a bit of detail, but that is only available to the vaccinator role, well, the primary care vaccinator role in the within the primary care bubble. So it is not available to site staff. Moving forward here, you do need to, when you do decide who is going to be taking a part in your COVID-19 vaccinations within your practice, we will need to actually get these users set up in COVax and then attributed to the appropriate role. So we do have on this particular screen here, you'll see that there are two links. The first link is actually points to the Niagara Region website, and that'll actually download this form that you see below here. The form is very, very simple. It's just going to include what primary care practice they are actually from, the user's last name, the user's first name, the profile that they're looking for. So again, that, as per the previous slide, that's either going to be COVax site staff or it's going to be the primary care vaccinator role. The other option is email. So it is important to note here that the email address is going to be how the COVax username is generated. So it's actually going to be your email address. So in this case, in my case, it would be nathan.smith@niagararegion.ca .COVaxON. So what that means is that an individual will need to be using this email to actually log in. So that does mean that even though you may want to use one email as the contact for multiple people, they do require their own emails in order to log in. And if at all possible, I would suggest your company or business email. I know that's not always applicable, as some users, again, only have Gmail accounts, or in certain practices, you may not have work emails for all of your employees, but it is, if possible, it is nice. Again, and this is just from a kind of uniformity standpoint. The other option moving forward is existing user accounts. That's in the G column here. In order to administer within COVax, you do need to be a part of the authorizing organization that the inventory is coming from. So if any of your users, less so for site staff, however, if any of your users, your vaccinators, say volunteered or worked at another one of the mass immunization clinics or another location administering COVID-19 vaccine, you will need to check this existing user account and you'll need to select true. The reason for this is that unfortunately, COVax is not able to add you to multiple authorizing organizations at the same time. So what that means is that if you say volunteered at with NHS, and you worked at Seymour Hanna administering in one of their clinics, you would likely already have a COVax username and password. However, that COVax username and password you will not be able to use when you're administering under the Niagara Region Public Health Authorizing Organization. What they'll do, you can still use the same email address. It's they're actually going to add 2 at the end of your username. So it's, again, I know that it sometimes gets a little confusing for vaccinators who do pop back and forth in order to help out in as many places as they can. However, if you're confused, if you're concerned, if you have any questions whatsoever, the NRPH COVax support at niagararegion.ca, the place that you're actually submitting this form, that is our general contact information. Again, I'll touch on that at the end of the slideshow. But if you have any questions whatsoever, if you want to validate something before submitting it, please just let us know. Again, this does go to myself or goes to one of our other business support analysts. So if we do have any questions, we will also reach out to you. The reason that we're, again, trying to be so thorough with this is that these accounts are created by the ministry. So once this is received by NRPH COVax support, we do actually need to, at the Niagara Region, we go through these lists, we compile them, and then we submit them to the ministry for account creation. Once these accounts actually are created, users will receive an email to the email address listed on file here. The email will include a password reset link in order to set up the password for the first time. It is important to note, though, that 24 hours is how long the link actually will last for. So if for any reason, if you get that email and for some reason one of your users doesn't actually activate or action it within 24 hours, the account will still be created. However, we'll need to generate another password reset in order to get that taken care of. Again, we'll tap into that a little bit more near the end when we go over contact information so that you know how we can best facilitate that as easily as possible.
I just wanted to take a moment to talk about the importance of data validation. All data entered into COVax, as I mentioned, is being used for either local or provincial reporting. For this reason, accuracy is extremely important. One area we want to highlight is client demographics. In mid-June, we identified 29,495, so approximately 10% of unmatched address records in COVax. Because of this, we're reminding all COVID-19 vaccine providers in Niagara using COVax to please ensure data entry staff are verifying client addresses when they come in for both first and second doses. This will help ensure addresses are correctly entered, which will help us in our coverage analysis. Towards the end of summer, this data will be largely used to inform targeted intervention for vaccine hesitancy.
Next up is COVax inventory management. So this is what I briefly touched on earlier when discussing the roles regarding the extra doses and wastages. We're going to dive in a little bit deeper into this right now. So you will, in the end-to-end training, either the end-to-end training or the daily workflow training provided by Ontario MD, you will go over quite a bit of information regarding how to actually manage inventories, receive shipments. It's a lot of everything that can happen within COVax. However, what we have done here with Niagara Region Public Health is we've designed this to make it as easy as possible for you as an end user. So despite what you'll see in the Ontario MD training, if you do the end-to-end training, a lot of that information, you will not actually need to, you won't need to apply a lot of those actions because we will have set all of these things up for you in advance of your clinics. First things first is your vaccination event. Again, I will give brief explanations for all of these terms. However, you will learn about these in depth within the Ontario MD training. The vaccination event, we do specify that you will have only one vaccination event per physical location. So we will have this pre-set up for you. You will not need to create a vaccination event. We'll be providing the name of your vaccination event to you prior to the start of your clinic. So your vaccination event is essentially where all of your doses are going to be administered, all your clients are going to be housed. The reason that we set these up for you is we don't want there to be, say, multiple vaccination events created because that's going to spread out different groups of doses, different groups of inventories, different groups of individual or of clients in different places. So this keeps it all in one compact little area so that it's easily sorted and easily reported on. As I said earlier, that's one event per physical location. We've had some primary care practices that do have multiple physical locations. If that is the case, please reach out to our NRPH COVax support at niagararegion.ca, and we're more than happy to facilitate that, again, on an individual basis. We just do need to make sure. I don't think that is as common. However, in the instances that it does occur, please reach out. We'll get it sorted out for you, no problem at all. The other thing that we're going to set up for you is your inventory and your vaccination event inventory allocation. So when you open up your inventory and you open up your vaccination event, you will already have the lot number and the product listed as live within your vaccination event. So theoretically, all you'll need to do, your vaccinators, is you'll be able to administer your client. You'll see the inventory that we've added for you on the drop-down list, and then you'll be able to administer without any issue whatsoever. The reason that the inventory is so important, and we're going to touch on this again a little bit down the screen here, but the reason the inventory is so important is because we have your inventory specifically set up in a storage location for you. So essentially what that means is that your office is the only one that's going to be touching your inventory within COVax. And if there's any issues, if there's any discrepancies, etc., it's on you to actually resolve. I say on you to resolve. Obviously, we're more than willing to support. I'm more than willing to help out in any capacity I possibly can. However, if you say received, call it 50 doses, and there are discrepancies, there are errors, there are things that are affecting your inventory, you'll notice that, again, once you hit 50 doses administered in COVax, your inventory will close. So you won't be able to over-administer past your inventory. If you do need an inventory transfer, so for example, you're transferring from one site to another, so you're either transferring or receiving from another primary care office. Again, this all does need to be approved. This isn't going to be something that's going to happen very often, but if there are extenuating circumstances and you need to make a transfer, this transfer can be done through Niagara NRPH COVax support at niagararegion.ca. We will facilitate that properly on our side. Again, it's not as easy as just minus and plus. We do need to make sure the appropriate transfers are made so that both the sending and receiving sites are completely up to date with their COVax records. So what you will be responsible for are your extra doses and your wasted doses. So that's what I mentioned earlier as far as your vaccinators. Your site staff are not able to actually make these additions or reductions. This does need to be done by the primary care vaccinator role. The reason that these are so important is because, as I alluded to earlier, if your inventory reaches zero, so for example, if you received one vial of the 14-dose Moderna and you pulled a 15th dose out of that vial, so the vial is rated for shipped as 14 doses. However, there is the potential to pull a 15th dose. If you say pulled that additional 15th dose out of your vial, it does need to be recorded in COVax as an extra dose, because that'll actually give a +1 entry to your inventory. So that would make your inventory 15 as opposed to 14. The reason that's so important is that when you're administering to clients, if you do not do that and you administer to 14 clients, you will not be able to administer the 15th dose because, according to COVax, you have no more vaccine to administer. As far as your wasted dosages, they're, again, equally important to update consistently because that will take away counts from your overall inventory. So it works in the exact same way. We're going to go forward here. I've created a few screenshots. Again, you will see this in the Ontario MD training as well. We have a very specific video on this that's going to be included at the end of this presentation. But just so we can quickly go over it, this is the general page you're going to see within your vaccination event. And near the bottom of the page, you'll see your vaccination event inventories. So you'll see the inventory that we have set up for you. It's going to include the product, the lot number of the product, the expiry of the product, whether or not the inventory is active. So self-explanatory, but if the inventory is active, you will, and has doses to be administered, you will see it as an option when your vaccinators go to administer to a client. If the inventory is inactive, you will not see that pop up on the drop-down menu. So if you ever are vaccinating and you see nothing when you go to administer the clients, there's nothing to select on the drop-down menu, it is very likely that it is an inventory related issue, and that's something that we'll have to look into and resolve for you. You'll also see, again, the allocated doses and your extra doses. This is just a very brief menu. I do recommend clicking the View All tab here in order to see an expanded view here. If the expanded view will just essentially give you this page over again, you'll just be able to see all of your entries with a little bit more information. When you do want to add any extra or wasted dose, you'll just have to go and click the blue hyperlink. So click on the name of your inventory here. So the name, the lot number, the expiry date. That'll bring you to this page here, where you'll actually, again, see a more blown up view where it'll have the doses you've administered out of the inventory, the extra doses, and the wastages. On the top tab here, you'll click the Related tab, and you'll see this screen below that actually goes over your inventory transactions. So that is your inventory history, what you have done previously with the inventory, as well as anything that you've added as far as extras or adjustments. To the right of this, you'll see your wastage events. You'll see your wastage event button, and you'll see your extra doses from vial button. So those are pretty self-explanatory. They're what I was describing earlier, and below them, you'll see appropriately, number one here, you'll see the new inventory transaction, wastage event, vaccination event. And you'll get a pop-up menu that will ask you to specify the reason. So that is a variety of different reasons. You'll pick the one that best suits what occurred with this wastage. So you have everything there from insufficient doses to pre-drawn syringes to vaccine administration errors. If you have any issues or questions regarding this, please don't hesitate to reach out to us, and we can certainly, again, discuss or remedy any questions you might have, as well as the quantity. So the quantity is how many doses actually were wasted. So the important thing to note here is that obviously if you enter anything into your wastages, any number you enter there, you'll enter the positive number. So you don't need to put a negative next to it. You'll just put, so for example, 10 in the quantity field, that will add a -10 entry to your inventory reconciliations to your event history back on this screen, the vaccination event inventory screen we looked at earlier. As well, there is a notes field, so you can include, again, a little bit of detail as far as what exactly occurred, just for the purposes of if we do need to go back and investigate what happened. The other field is the number 2 option, which is your extra doses. Exact same type of thing. You obviously don't need to put a reason, because you don't need to put a reason for pulling an extra dose. You can just put the quantity, so how many extra doses, and again, that will be a positive entry that will apply to your inventory. And then in the notes field as well, I would say just add a note saying that pulled 15th dose, or pulled doses in some detail regarding what actually transpired. So specify the day. The important thing to note here is that all of these transactions need to be recorded on the day that you're actually doing them. So please don't, if you're going through if you're having clinics on multiple days, or you're having clients come through multiple days, please don't save your extra or wastage entries for the end of your clinic and apply them all in one go. You don't need to be applying them if you're pulling multiple vials per day. You don't need to be doing +1, +1, +1. You can certainly wait till the end of the day to add a +3 or any number that you need to, but please make sure that you're staying on top of this so that you're not trying to resolve it at the end. This is important both from your ease of use standpoint, but also from our reporting standpoint, because we want to make sure that when we do look at snapshots and we look at how well everybody is doing, if you're not entering your extra doses, that it becomes quite a bit harder to actually determine because there's discrepancies in numbers. All right, I think that about covers inventory. Again, there will be a video where one of my colleagues actually goes in live and goes into our training environment and goes through these. So if you have any questions whatsoever, please reach out. Please definitely let us know. Actually, one more thing before I jump off the topic. I'm going to just loop back to what I said earlier. Please make sure that you are entering these extra doses specifically because you need to, on the last day of your clinic, you will need to have these extra doses in. Because if you go to administer that 15th dose or the extra dose, and you haven't been adding your extras, or you didn't add even the one extra from that one day, you won't be able to administer in COVax and your inventory will close. Again, that's going to be something that you're going to require assistance resolving, and it may cause a momentarily small panic in the sense that you won't be able to administer. And obviously we want to, if in any way, shape or form, we want to avoid any issues that you might experience in your clinic. So this is the video that I mentioned earlier. This was done by my colleague, Andrew. This touches, again, more specifically in everything that I just mentioned regarding inventory, but it's a live view of how to actually do it. You'll notice once you do it once, it is a very, very straightforward process, but it is something that, again, is incredibly important to the overall success of your clinic. And we would love if you just reach out to us if you have any issues. Don't try to do something if you're not 100% confident on it, because again, that's why we're here. We're more than happy to support you on that. Last slide here, well, second last slide, is the Salesforce two-factor authentication. So this is actually the authenticator that needs to be used every single time any of your users log into COVax. There may be some of you out there that are familiar with two-factor authentication. Some of you may not have been yet. Essentially what this is going to be an application that you install on your phone, and it's going to essentially act as a validator for when you try to log into COVax. So when you do go and log into COVax, you put in your username and your password. Your phone will actually prompt you whether or not it is an approved login. And when you hit approve, you'll be able to complete your login into Salesforce, into Salesforce or COVax. The reason that this is in place is obviously there's a lot of sensitive information within this particular system, so they do want a level of validation to ensure, to try to mitigate any potential breaches in security. There will be a full guide as to how to actually install this application and get it set up and configured. Again, there's quite a few instructions. However, it is not a difficult process. It is very, very straightforward. And once one of your users, I'd recommend one of your stronger users or who's ever taking the lead, goes through this process first, and then you can, again, you can describe it or explain it to other users if needed. The one major thing that you will notice is that when you do set up your password for the first time in COVax, you are able to log in once without the authenticator active. It will prompt you on that screen once you've logged in to set up your authenticator. Please do not ignore that particular prompt, as for subsequent logins, you will need the two-factor authentication set up. So essentially, if you set up and for some reason, once you first log into your user account, if you don't set up your two-factor authentication, it will not let you log on subsequent times, and we'll need to get you another password reset to get back into the account to set it up. This brings me to my final slide, the COVax assistance contact. Like I mentioned before, COVax is a ministry application. However, we do want to, if at all possible, provide you as much support from the Niagara Region Public Health level as we can. So please, if you have any concerns whatsoever regarding information, regarding your actual daily clinic flow within COVax, please don't hesitate to reach out to NRPH COVax support at niagararegion.ca. My name is Nathan Smith. I didn't include my personal information on this slide, just in the sense that I'm not always on, and I know that varying clinic schedules, we want to ensure that we respond to you in a timely manner. So there are additional business support analysts that will answer this email for you as well, and we'll give you the best chance at getting a response as soon as possible to get you up and running again. We'll handle everything again from account creations to COVax inventory issues to just general user setups. Anything that we can possibly assist with, please don't hesitate to send us an email and we'll do whatever we can for you. The other option that we have listed on the screen here is the Ministry of Health call center for COVax password resets. So once your account is created within COVax, a lot of what they do in the call center does require a user such as myself from the authorizing organization to actually request. However, the one thing that users can call themselves to request are COVax password resets sent to their email address. So if you do run into any issue where you're locked out of your account, you are more than welcome to, at a user level, call the Ministry of Health Contact Center, and they will give you a call, they will process your password reset for you. They'll send you a link to your email address on file, and then we'll get that resolved. Again, they won't be able to modify any information for you. They won't be able to create new accounts for you. This is only for password resets. Again, I've mentioned it several times throughout this process. If there's anything that we can do, if there's anything that confuses you as far as just it doesn't seem right, please reach out to us. We would much rather reach out to us proactively. We have no problem setting things up and working with you. We just don't want to, again, potentially have some incorrect entries put in, or something that we were not able to report on, as Carolyn alluded to earlier. Thank you so much. If you need anything else from us, please definitely let us know.